There are many functions of sleep. I mean, we go through this every night. So there must be a reason why we sleep. Part of the reason is we restore our mental health. So actually all the brain, chemicals that have accumulated through the day get washed away during sleep. Okay, so that's number one. And we know that you're tired, you go to sleep, you wake up, you feel fresh. Fantastic. Your muscles are as well. How your body works is that it accumulates chemicals and then washes them out at night. So your brain accumulates chemicals, your brain health. Your body accumulates chemicals, washed away. Also, your mental health as well. Remember, we used to be told if you have, our grandmothers used to say, if you have something that you're worried about, sleep on it. Why? Well, unfortunately, science doesn't know. But you feel better. Your brain organizes it. We don't know how it happens. Right. And but it happens. And then finally, the function of dreaming. We don't know what dreaming, why we dream, but it does help. Stage one is entry point. Okay, you can easily wake up. Stage two, your body relaxes. You'll feel if we measure it, you'll find your heart rate goes down, your body temperature dips a bit. Your body is relaxing. Stage three is where a lot of the chemicals are worn off, and which is dream sleep or REM sleep, your entire body relaxes and you dream and then you go back into. So all those little stages are super important. Okay. And if you don't go down into sleep, down into the depths of sleep, then you don't get restored. Patients are very worried. They ask, can my brain give up? And I tell them, your brain will not give up on you. So that is a reaction, and that's what gives you all those micro-arousals. And that's why you keep on waking up. I've got patients, when we do the testing, it can happen actually even up to 100 times in an hour.
What?
It's crazy, the numbers that we see. But we'll talk about that during testing.
Okay.
Yeah, because we can test these things. When you think about nighttime, so I'll talk about night and day, because this will answer the question, how do you know you have this problem? Okay, so nighttime, of course, it'll be snoring. So there's a sound, and then there's the silence, the gasping, the choking, and then a micro-arousal. And for a lot of patients, they don't know they've woken up. Okay, it's a micro-arousal. For some patients, they actually wake up and they feel, I need to go pee. And you'll notice that elderly patients, yes, there are many reasons why people wake up to go pee. Yeah. One of them is sleep apnea. Okay. It's not just that you have a large prostate or you've taken a lot of water or something like that, or it could be sleep apnea. Okay. So those are the nighttime symptoms. Okay, and I think that is pretty clear. Yeah. But there are daytime consequences of not going down into sleep. You wake up feeling unrefreshed. That is very obvious. You wake up having morning headaches that clear up. Okay, you're not getting enough oxygen. You wake up feeling tired. You wake up having what is called EDS, excessive daytime sleepiness, where you're a driver and you feel like dozing off. You're a computer guy, you work in front of your laptop, you're dozing off. And you can imagine you're a driver, you're a pilot, what we call mission critical workers. Yes. Okay. You can't MCWs, mission critical workers. We see them in the clinic, and obstructive sleep apnea is a hazard for them. So that answers your question. How do I know? Usually it's daytime symptoms. How does your partner know? Maybe it's nighttime symptoms. The biggest challenge are those who sleep alone. And a lot of people don't have bedtime partners. Okay, yes, yeah. So how do they discover that they have obstructive sleep apnea? Yes. Maybe you go to your friend's house, you go to a relative's house, you doze, you're told, hey, Bwana, you're really snoring, or we are actually worried you are gasping, we've been nudging you and stuff like that, you know. And then the third category are those who absolutely have no idea or have been ignoring. So you go to your doctor, you have uncontrolled hypertension. So now I think that goes into the consequences. Because why should we care? Right. Is snoring a nuisance? Or is it a danger? Right. So for those who it's a danger, you get uncontrolled hypertension. We've got patients who've been referred to us, guys. who are on 3-4 antihypertensives. The doc is, you have a fantastic doctor. They're on the top of the game. They're giving you the latest medication. It's just not being controlled. You have, and that's because of, hypoxemia. You've got diabetic patients who have uncontrolled diabetes. Of course, what I'm saying is that there are other reasons. But there's a reason that we have that is called obstructive sleep apnea that can be sorted out. You have mental fatigue. You can't concentrate. You feel like I used to be sharper than I was. You're irritable. Now remember because
What are you laughing at? He literally laughed and looked.
How you reacted to that? Like, yeah.
I think after this, Eric and I will sidebar. Like, is there something you'd like to say?
Yeah,
Sorry.
yeah, and that is very significant because remember I said it levels out after menopause. The problem with obstructive sleep apnea is that it looks different in men than in women.
Right.
In men, it's very classic. We know those classic. I don't even need to tell you. Snoring, sleep apnea, and all that stuff. But in women, postmenopausal, how does it present?
Yeah.
Irritable, bad mood. You have this, what we call psychosomatic. You feel neck pain, shoulder pain. You have facial pain. Okay, not really headache, but facial pain, You're getting...
Uso yako inauma.
Yes, we call it facial pain, And those are some of
Eric
the
is
symptoms.
lost, is stuck at unaumwa na uso aje. Yeah.
Hospitali ni nini imekuletea?
Unaumwa na uso. The reason is that headaches, most people complain about. Here, you feel like you feel it at the front. Yes, yeah. So those
You feel
are
it like
some.
at the cheekbones.
You feel it at the
eyes
cheekbones,
and
yes, and you can. Some of them talk about other reasons, but a lot of it is obstructive sleep apnea. And then we've not even talked about children. Because children is a totally different animal. Yeah.
Social jet lag. Explain what that is and how it also plays in.
Okay. So when you look at sleep, there are about 7 different conditions that affect sleep. The first one we all know, insomnia. That's the biggest one, and we're not going to talk about that. The second one is sleep apnea, obstructive sleep apnea. That's what we're talking about right now. The third one is circadian rhythm disorders, okay? And then the fourth, that now what you're talking about is jet lag. We are moving between time zones. So that's a big deal, especially in the aviation industry. So that is new, about maybe 100 years old in terms of sleep disorders. Yes, yeah. And usually physicians are the ones, or aviation experts are the ones who deal with that.
Okay, the one I had heard about is social, which is, it's almost the same feeling you get when you're jet lagged, but it's like a cycle of exhaustion. That's why I was saying social.
Yeah, the biggest problem with a lot of sleep disorders is that you're going to have common symptoms.
Okay.
Because as long as I'm disrupting your sleep, I'm going to have some common symptoms. Okay. Yeah.
Okay.
And then I also have some unique symptoms. So you'll never have a patient with insomnia talking about, maybe snoring.
Yeah.
Okay. Usually those are very different. Yeah.
Among the things that you talked about, like you said, there's snoring, there's wheezing, and all these others. So if somebody, for example, is asthmatic, are they more prone to having these obstructions in their sleep? If somebody has, say, problems with their sinuses, something on their nose area, can it affect the throat area?
in their ENT.
And the ENT area,
Yes,
yeah. So you've actually hit the money ball because snoring and obstructive sleep apnea is an upper airway problem. Wheezing and asthma is a lower airway problem. So half of your question is actually correct, where nose problems. You've been knocked about, used to play hockey, used to maybe be a boxer or something like that. You have a crooked nose, deviated septum. You have large polyps inside your nose. You have turbinates. So all these things are inside your nose, just basically blocking the airway. And for anyone who's an engineer or a pilot, you know about turbulence and some of the physics, Bernoulli's phenomenon. Am I bringing some...
But Bernoulli's
Bernoulli's principle.
Bernoulli's principle.
Okay.
Bernoulli's.
I've heard of it, but I can't remember what it was.
But basically, blockage in your upper airway causes collapse in your, in your throat.
Okay.
So you're very right.
Okay.